To make it through medical school, I had the Air Force pay on scholarship, and so I did my internship in Ohio and then 4 years of training in San Antonio. So I spent 9 years in service in the Air Force and came here in 1992. Getting close to 30 years here in this community at GRMC. I chose orthopedics for several reasons. And the first of which was when I went into medical school, I really wanted to have a broad range of practice, and orthopedic surgery allows me to treat from the cradle all the way to the elderly patient. And so I enjoy taking care of a broad range of patients. I also did it because I enjoyed the outcomes that we see. And so we are a repair and reconstruction specialty. We essentially take care of the musculoskeletal system. In the musculoskeletal system, we're talking about bones and joints primarily, so a lot of what we do is repair and reconstruct. One of the things that was very interesting to me in going into medical school is I wanted to do medical missions at some point in the future, and this has allowed me to do that in a short term. With something like orthopedic surgery, you can go into a third world country, you can take care of that deformity or repair that fracture that healed wrong, and go in, do your job, and you've affected those people's lives for the rest of their life. Some of what we do as orthopedic surgeons is repair broken bones, take care of injuries like that. We also take care of chronic deformities. People get arthritic changes in their knees or their shoulders or their hips. So one of the things that we do as orthopedic surgeons is joint replacement. So I do shoulder and hip and knee replacement surgery. And that's a large part of my practice from day to day. A large part is taking care of fractures. And then another part is taking care of things like sports injuries. And so we in the musculoskeletal field take care of a broad range of both acute and chronic problems. One of the most joyful things I still have is going into the office, sitting down in the stool in front of a patient and say, okay, why did you come to see me? And try to piece together the problem and then come up with an answer to hopefully improve their quality of life most of the time. We have such a good working relationship with the hospital, and the hospital has been a good hospital for us to work at for all those years.